Here, let's talk about carotid sinus hypersensitivity. So the name tells you that the carotid artery is hypersensitive. Hypersensitive to what and what does that lead to is what we really want to understand here. What I have here is heart and the aortic arch. The first branch is brachiocephalic. Let's not worry about it. Carotid artery, common carotid artery, soon branch off to become internal carotid and external carotid arteries, and that other one is left subclavian. Anyway, so here I want you to consider this as a carotid sinus, the broader point right before it branches off to become two vessels. Okay, so this is our carotid sinus. All right. What's so special about it? Why do we want to look at this? Is where it's important. Baroreceptors are situated here. Baroreceptors detect blood pressure, and whenever they're activated, okay, so pretend that you're massaging the neck. That's where you would feel the carotid artery, and now because it's hypersensitive, baroreceptors are activated and they take the signal to the brain centers in the medulla. And then there are two things that would be turned on or turned off. One of them is the inactivation of the sympathetic system. What does that do is where you have to think about decreased vascular resistance. You see, that would lead to resistance, would lead to decreased blood pressure. All right, so that's one situation. And another one is increased parasympathetic activation. What would that do? Parasympathetic activation would cause the heart rate to drop. Decreased heart rate would be referred to as bradycardia. All right, so you have two conditions. The bradycardia is the most common condition. About 80% of the patients with this condition would suffer from bradycardia, severe bradycardia, all right? And then about 10% are affected by the low blood pressure, and another 10% of the patients would be having both bradycardia and low blood pressure. So how do we help these patients is where you have to think about placing a pacemaker or carotid artery ablation, you see, and then medication is the other option. Now, if you're anesthetizing this patient, and if you're aware that this patient has carotid sinus hypersensitivity, close monitoring of the heart rate and blood pressure is extremely important. All right, that's all you want to know about this. Thank you.